My name is Darlene Beckett. I live in Boca Raton, Florida, and I'm 75 years old. We have 4 daughters and 1 son. Photography is my #1 hobby, and I've enjoyed traveling with my husband. 47 of our states we've seen, and many, many countries, and he did volunteer work in Africa where I joined him. So summers we went to Kenya, and they did wonderful work there for the poorest of the poor. I just felt it was important as a mother to volunteer. I did enjoy volunteering for our political presidential candidates when they ran, and I did have the joy of working with President Bush, and that was a privilege to do. 2018. My husband slipped and fell and asked if I would pick him up. And when I picked him up, I injured my back and my neck. I knew I was extremely injured. I had neck and back pain. My legs dragged when I walked. I could barely lift my arms to feed myself. I had tingling and numbing, and I was in extreme pain. Came home from vacation and sought help right away.
Mrs. Beckett's diagnosis when I first saw her was one of cervical stenosis and cervical myelopathy. In other words, pressure on the spinal cord that was causing issues with her gait, weakness, as well as pain and difficulty with her balance.
My husband's neurologist and Dr. Vrionis told me the same thing, that I needed surgery immediately or I would be paralyzed for life.
The long-term effects of somebody ignoring the issue or putting a band-aid on the issue would be that she could have been in a wheelchair for the rest of her life and had irreversible damage to her spinal cord.
He was kind and compassionate, and he fitted me in his very busy schedule, and my surgery was done within 3 days. And I am so grateful that he made time for me to do that. He saved my life.
The surgery I performed on Mrs. Beckett is called an anterior cervical discectomy and fusion. I had to do that for 2 levels because she had 2 areas in her spine where she had compression of her spinal cord. The difference is that I never use any allogenic bone graft, any cadaver bone graft. So pretty much it's the patient's own bone graft at the time of the surgery. The second part is that I do what's called a double fixation of the spine, so that way the patients don't need to wear a collar after surgeries. I have found a way to eliminate that, and actually this is something that I validated in biomechanical studies and published in the past.
I would highly recommend him. He had me up my first night in the hospital, walking, feeding myself, absolutely no pain. I never took any pain medication that was offered me. Not one pill did I ever need to take.
Mrs. Beckett is doing well from her spinal cord compression standpoint. She can walk, she can do pretty much everything that normal life allows her without any pain.
And I am so grateful for my results that were 100% successful in my surgery, and for a very exceptional man with a humble spirit and a gracious, gracious bedside manner. I cannot thank him enough for what he did for me.